How to know if your surgical wound is reopening. Imagine feeling a sudden change at your surgical site that makes you worry. It can be confusing to tell if your wound is just healing or if it's opening up again. Knowing the signs is important for your health. First, look closely at your wound. If you see the edges pulling apart or notice a gap along the incision line, that's a sign it might be reopening. Sometimes stitches, staples, or glue may come loose or break, revealing a gap. If you notice holes or gaps where the skin used to be, it's time to get checked. Next, pay attention to how it feels. If you suddenly feel a pulling, ripping, or popping sensation, it could mean the wound is giving way. This might happen during coughing, lifting heavy objects, or sudden movements. If you experience this, don't ignore it. Watch for any bleeding or fluid. If you see fresh blood or clear, pink, or pus-like drainage coming from the wound, it could be a sign of reopening or infection. Sometimes, the wound might ooze more than normal, especially if it's not healing well. Pain is another clue. If the pain becomes sharper, more intense, or different from the usual healing discomfort, it might mean the wound is not healing properly. Increased tenderness or soreness that doesn't go away should be checked by your doctor. Check the skin around the wound. Redness, swelling, or warmth spreading beyond the incision site can be signs of infection or wound breakdown. While some redness and swelling are normal early on, worsening signs need medical attention. Look at your stitches or staples. If they appear loose, broken, or missing, the wound could be reopening. Sometimes, the skin may start to pull apart at the edges, especially if there's strain or pressure on the area. Be alert for other symptoms like fever, chills, or bad smell from the wound. These can indicate infection, which often accompanies wound reopening. If you notice these, contact your healthcare provider immediately. In severe cases, you might see deeper tissues or even organs. This is rare but serious. If this happens, it's a medical emergency. Most wound reopenings happen within the first 10 days after surgery. Activities like coughing, heavy lifting, or strenuous movement can cause stress on the wound. Conditions like smoking or diabetes can slow healing and increase the risk. If you notice any of these signs, reach out to your healthcare provider right away. Early treatment can prevent further problems and help your wound heal properly. To help your wound heal well, keep it clean and dry as your doctor instructs. Avoid heavy lifting or strenuous activities that put pressure on the area. Follow your doctor's advice about medications and wound care. And always report any unusual symptoms immediately. Knowing these signs helps you stay on top of your recovery and ensures you get help when needed. Your quick action can make a big difference in healing smoothly.